Joining us now to discuss some of the ongoing celebration efforts to improve healthcare in Gauteng as well is the Health MEC, Nomantu Nkomo-Ralehoko. MEC, very good morning to you, and thank you so much for making time for us this morning.
Morning to you too, and morning to the viewers at home, Aldrin.
So starting off with this one, the number of babies that were born in the province, no surprise that once again Gauteng is leading when it comes to that particular number, considering that we are the most populous province compared to the other provinces. But what's your expression and also your insights into how the Gauteng Health Department was able to handle the pressure, especially during Christmas Day, for the Christmas babies?
In fact, we must start by congratulating those parents who have embraced this incredible journey, because it's not an easy journey to be pregnant, including the person that supports you in that process. So in each child that has been born, it is truly a gift to all of us as South Africans. And maybe because we have seen that now we're putting them immediately in the Home Affairs database so that they are being known when they leave the hospital. But what we have done again as a province is to make sure that we work very closely with all the community health care centers, with all the hospitals, and we had educational programs that we've been doing to our communities in relation to the issues of pregnancy. And I think that has worked. But again, we have a dedicated staff now in our maternity unit that has worked tirelessly to comment to this excellence that we are getting, because even the incidents of finding a parent not losing a child during birth, it was not much in the province. I think we have minimal, because we're still trying to check, was we have not have any records, in fact, so far that we have received. So I think for us, we need to mention that we've improved our maternity units in the hospitals, because after so many questions that we have been having of why are we not having proper maternity units in the hospitals, in the community health centers, we're even upgrading them as we speak in the area of Ekurhuleni. We're upgrading 3, and we already have 4, the first one that we did in Davidson, because we want them to be at the level that every child that is giving birth, or every parent, if I can put it like that, that child is given birth in a proper place. And I think parents are happy. And again, we've been encouraging them to go for their clinical services, to make sure that when you are 2 months pregnant or 3 months pregnant, once you discover, you must start now going to the clinics. So we're happy. And let me tell you interesting thing, that Tembisa is leading with 22 babies in the whole province, followed by other hospitals then. But out of that, it shows that again, our focus have been in Tembisa. Based on some of the incidents, I know at some stage you even called me for an interview in terms of us not promoting the neonatal wards in Tembisa, making them better wards. So we've done that. We've managed to make sure that Tembisa neonatal is one of the better places that we can go and deliver. And parents are happy about it, because they've been going there, and we're even up even pressure now at Tembisa to other community healthcare centers around Tembisa area, which we have upgraded them now so that they can be in that level. So we're celebrating this new life as a department, and we're excited, but we'll continue with these educational programs because they are helping us, especially this one on teenage pregnancy. We even last year decided, after again your interview, of making sure that we have a teenage framework, a document that we created. It sits directly in my office. I'm the one that is leading that committee, because I felt that after I've been receiving children, 13-year-olds, 14-year-olds with babies, I was very traumatized. And then I realized that instead of me being traumatized, telling yourselves about this, I must come with alternatives. So I think it's working, it's bearing results, because now we are focusing on making sure that we talk to the parents to allow us to prevent their children when they are at that stage now that they can be pregnant.
Yep.
We are using Implanon. It's very expensive, but we are using that. But besides the other measures that we're doing as a department.
Yeah, and what are the stats in Gauteng looking like? Because you did say that when it comes to the province as well, we've seen a decline in the number of teenage pregnancies.
It's very minimal, because I think we don't have more than 6 young ones that we have received in province-wide. So which means it's one here and one there in another region. So those are the stats that we have received so far. But it's good that again we have a system. I'm convinced that those are the correct stats, because I will even send you a database, a spreadsheet that we have done of each and every facility. How many number of children, which ones do we have, where are the females? So that stats, it's already there. That's why I even delayed to come to yourselves and talk to you, because I wanted to have that clear information that will talk to those numbers that we have. So far it's 5, and we have 209 boys. I call them boys, not males, and 184 girls, not females as if they are old already. So I still treat them as little bundles of joy. So that's the number that we have that are healthy, that are in the hospital. Some have already discharged them.
Yeah, and out of the 6, what's the age of the youngest mother?
The youngest mother has been 14 out of that, and then the others are 16 and then up to 17 then. So it's not that much. We're not extreme like we were last year, because last year we're really extreme in terms of that.
Yeah. And in this particular case, when health workers come across an incident where a 14-year-old is pregnant and about to give birth, what's their responsibility in terms of what's expected? Because this essentially, we are dealing here with statutory rape.
Our responsibility is to ensure that we support that child. We work very closely with the Department of Social Department, and we make sure that again, because she can't even handle the child, by the way. We started there. She can't even breastfeed. We have to start and make sure that we teach that child to breastfeed. But on our side as government, now we've applied with the Department of Justice to be the friends of the court, so that when there's a man that has raped a child, we're able to release that information because we have the files. Because I remember sometimes those guys will say there's no evidence. It's their work, by the way, to do that when they start cross-questioning the child. What is the evidence? Why do you know that? So we do have sessions with that child, counsel the child, make sure that the child is she feels that she's amongst the family instead of making the child feel bad. So those are the things that we've been doing. But again, what we have done, Aldrin, that is reduce the number in all the hospitals and the community health centers in the province. We've employed young now and doctors and young nurses that talks to them directly, because when they go and look for things for prevention, they are able now to be attended to by the people who are at their age. And if you go to any of our hospitals or community health centers, you will find them standing there where people are sitting doing educational programs on the do's and don'ts and what is expected if you are pregnant. I like those sessions because they are done by the young ones. Some, they have an experience of going through that, because I said to the team, let's look even for the ones, employ the ones that have been through this process, because it's easier for you, Aldrin, to listen to me if I say I was there. I know what you are going through. Don't do this. This is the issue that you must do if you want to prevent teenage pregnancy. And this thing destroys them completely. It destroys their life.
Yep.
Because look at a 15-year-old, if it's having a child, that thing, it's a child itself. So you can't encourage that. So I'm really happy that the team understood when I said this must be our focus. Let's channel our energy and our resources to ensure that this does not happen again.
Do you know of any arrests, MEC, that are emanating from these 6 births that were given?
At the moment, no, because remember, we have now to start forwarding the file to the Department of Social Development, work with the Department of Justice so that that process can be done. But again, the problem that we're experiencing, the families, they will say this thing must be talked among the families. I remember last year, a 16-year-old, that one was at Bekimlangen, and the families were pleading with me that, no, MEC, leave everything. Don't even take some information that we were needing. But I said, I'm not going to leave that. I'm going to take that information because it must be in the file, because they were saying, we're going to discuss it amongst ourselves as a family. It hurt me so much because now you can see that there's this collaboration, us as parents now allowing our children to go through this trauma that they've been going through before, even after they gave birth.
Yeah. And finally, speaking now from a health perspective and from a biological perspective as well, MEC, is it clear why we are seeing more and more young girls, their bodies being ready to to conceive and then also being ready to give birth, even though they are very young, some of them as young as 12, we've heard before, still in their adolescent stages, in some of them, but the body is able to conceive. Is there something that is happening in what is being eaten that has forced the bodies of young girls being able to conceive at such a young age, even before they move into their teen years?
No, you are right. It's some of the things that they're eating, but I think again they're productive sexual. It's very active. They're active, so it depends in a number of children. Some will be active in that space. So those are the things that then we need as mothers, especially because I always say as mothers who can be able to talk to them. You notice when now you can see that she's becoming sexual active, and you can see that she's not. You know, they become edgy when they're even here at home, when they have little boyfriends or they're starting to do something. And it's a different situation when a child is raped. But this one, you can see that now it must be protected. That's why when I even go with these educational programs, I don't leave primary schools because I'm going to start. I have a program called Integrated Health Program that I work very closely with the Department of Education. I go with the officials from both sides, including social development. I talk to those ones that we can see that they've grown already. They have some legal, you can see that amabelenyana lana ayakhula. So you can notice them. You can see even when you're talking about these subjects, they'll start laughing at the back there. So those are the ones that we're targeting. And I always say to the teachers, let's identify them. You know them. You stay with them every day. Bring them so that we can do these sessions amongst them, including those boys that are at that age that you can see they're starting to walk a different way of walking because they see themselves as boyfriends among girlfriends. So that's what we have been doing. But I think it's a serious problem, even in terms of that. I think the health specialists must assist us in terms of going and check further what is it that we should feed them so that we can suppress some of these active parts in their bodies.